12 will be reporting on the effectiveness of negative pressure closure in the integration of split-thickness skin grafts. The intervention for this study is a negative pressure closure, which intends to produce traction of soft tissues, which diminishes the surface and depth of injury and improves its irrigation. Based on the PICO table, the research question for the study is: did the use of the central aspiration system at negative 80 millimeters mercury along with negative pressure closure prove to be more effective as compared to a similar dressing but without the connection to negative pressure in integration of split-thickness skin grafts? The participants for this study are burn patients having wounds with skin loss which hindered primary closure. The intervention is negative pressure closure dressing, which is connected to central aspiration system at negative 80 millimeters mercury. The control is similar dressing but without connection to negative pressure. The outcomes are area of loss of skin graft, which is the primary outcome, followed by the secondary outcomes, which are need for regrafting, ratio between graft size and loss area, and the number of days of hospital stay between date of intervention and patient discharge from burn unit and regrafting requirement. The study is a quantitative, analytic, and experimental study. The 60 participants were obtained through random, double-mass control trials and cluster sampling. The inclusion criteria is all patients who have acute traumatic injuries and skin loss which hindered primary closure, surgical cleaning of the wound, and quantitative biopsy culture which had a bacterial count of less than 100,000 per grams of tissue. Meanwhile, the exclusion criteria is all patients who have burns that covered more than 20% of their total body surface, polytraumatized, and surgical contraindications because of medical anesthetic. This flowchart shows how the researchers conducted their procedure, which starts from 60 patients that had an operation. Duration was not specified, and the wounds were assessed immediately after the surgery. Next, computer-generated randomization was used to distribute the 60 participants equally into the NPC and control group. The NPC group had dressings with vacuum seal, while the control only had the dressings. Both groups had their wounds uncovered on the 4th day post-surgery. These wounds were assessed through digital photos that were analyzed by the AutoCAD software. The first 3 outcomes were measured by digital photographs taken without flash at a distance of 40 centimeters from the wound. These photographs were then analyzed by the AutoCAD software. The last outcome was measured based on the dates in the charts of the patients. No psychometric tests were conducted for all the outcomes in the study. The measure of central tendency was for the average and median of change in baseline characteristics and secondary outcomes between NPC and control groups. The measure of location was for loss of grafted area. The scatter plot was for the correlation between the graft size and graft loss, while the box plot was to present the main and secondary outcomes by treatment allocation group between NPC and control groups. These tests were used to measure the variables presented in the study, all of which are correct except for ANOVA, since it is not specified. The results proved that the negative pressure closure was effective since the p-values obtained for all the outcomes were lower than the set alpha level of 0.05. As future PTs, we will use the intervention since the study was found to have more strengths than weaknesses. The strengths and weaknesses were divided into participants, methods, and statistics. If sample size calculation was used, the power of the study could have increased. Masking was done to remove the bias. The use of ANOVA was incorrect because it was not specified.